Well, back on health now, because the trust that runs Northumberland's hospitals has announced it's building a new hospital in Berwick. And the £25 million it will cost to build is being loaned to Northumbria Healthcare Trust by Northumberland County Council. The new hospital will be built on the site of the present Berwick Infirmary, with healthcare continuing to be delivered throughout the building process. Adrian Pitchers reports.
Queen Victoria had barely settled on the throne when Berwick Infirmary first opened its doors. The hospital provides day patient services like physiotherapy, blood transfusions and chemotherapy. There's a minor injuries clinic and maternity unit, which reopened last July. All of these services will continue in a modern, state-of-the-art hospital.
I think it's fantastic. To get the facilities that you need, you have to travel. And I think obviously if they repair the hospital and make it better, I think it'll be good for the community.
Darren has physiotherapy once a week after a pioneering knee replacement operation. Living in North Northumberland, he wants to be treated close to home.
The service is fantastic. I had a major operation a few years ago and I would have had to travel to the Freeman in Newcastle every day, which is about a 120-mile round trip. The facilities here are good, the staff are fantastic, so obviously I can come here instead of going to Newcastle.
New hospitals don't come cheap, but they can be cheaper if the money can be borrowed at the lowest possible rate. The County Council can do that and then loan the funds to the NHS Trust.
Without us being able to provide the finance, it would significantly delay this fantastic opportunity for Berwick.
Couldn't you be spending that £25 million on filling potholes or adult social care?
It's a good question, but no, we didn't actually physically have the £25 million. We've actually borrowed that money in order to lend it to the Healthcare Trust, because we can borrow it at a significantly less rate than they can.
At an information event this afternoon, the lead medic cheerfully admitted that continuing to provide services while rebuilding the hospital on the same site would be quite a challenge.
I'm really not sure how we're going to do that yet, but they've looked at this and they feel very confident that they can arrange it. The site itself is very spread out. There are a number of buildings that are not being used at the moment in there, and presumably we can work through those and work around with that. But I agree, that's the challenge.
This is a phased rebuild. They're actually rebuilding the hospital while still providing services on site. So it's going to take a while. It should be completed by late 2018. Adrian Pitchers, BBC Look North, Berwick.